Hello, I'm Mary Burguieres. I'm Lead Manager for Policy and Strategic Partnerships at Surrey County Council. Information sharing is fundamental to public service reform. Public service reform is not about getting better and better at delivering single services. To a great extent, public services have done that already. Public service reform requires whole system change, and change that's about delivering fundamentally differently and holistically around better outcomes for people and communities. So what does that require? Certainly no one service can do that alone. What I've found through working in Surrey and with colleagues now in Sussex as part of our devolution ambitions is that we need to use our information and our data collectively across public services to understand the complexity of the needs of people and the interrelationship between those needs. So we're working with police colleagues, we're working with districts and boroughs, from my standpoint of view of being at the county council. We're working with our mental health providers, we're working with our CCGs, we're working with our ambulance service to understand how service users come into contact with our services individually, often, the episodes that bring them into contact with us, what outcomes they get, and where we could work better to respond earlier and in a more preventative way that will help improve their lives. I'll give you some examples of how we've begun to use data and information sharing about service users in a much more whole systems way. We've recently in Surrey launched 5 new safe havens. These are places where people in mental health crisis can come and find support, both from peers, so other service users, people who themselves have experienced mental health crisis, but also mental health professionals. We also provide in those places access to information about whether employment or other types of services that may also meet their needs. But they're an alternative to going where we know many people have gone to A&E or calling the police, 2 least good places for them to go. So through our information sharing with our acute hospitals, with our police, with our mental health provider, and with our third sector, we really understood the experiences of people in mental health crisis. We shared that data through our crisis concordat, we looked at it, and we thought about a different response. So the safe havens are our alternative. They're our whole systems response. They're not provided by one service, they're provided by a multi-agency partnership. We know the data is still early, that we're capturing through the experience of people going to the safe havens, but we know that they are using them as an alternative to going to accident and emergency. So already we're having an impact on people's lives, and already we're having an impact upon acute services that are costly and where demand is spiraling. So I think that's an example of how you can use information collectively, so that gathering data together, analyze it and think about alternatives. So that's the change, that's the transformation, and then continue to collect data to tell you about the impact on individuals, but also the impact in terms of better outcomes for our services. Obviously, within that setting of a safe haven, we as local leaders had to come to a common agreement about how we would share the information that patients, that service users were providing in safe haven settings. So we agreed to some common protocols in terms of what's confidential to the patient and to the practitioner, what can be shared more widely, what we would expect from, let's say, an ambulance that might bring someone to a safe haven rather than to accident and emergency, what they would be providing in the handover. So a whole layer of complexity in terms of information and data sharing, but it's really all about that person who previously would have had possibly quite a rough experience at a very difficult time of their life. Surrey was really privileged to establish a relationship with the centre very early on in its creation, and it's been I hope a mutually beneficial relationship. But certainly, we were very keen to have the centre work with us in the development stage of the mental health crisis program, and so the centre became an integral partner actually in our multi-agency partnership. From almost its inception. And we drew upon the insights that the centre had in terms of signposting us very quickly to some of the issues, some of the challenges that we were likely to face around information sharing. So it was at the forefront of our local leaders' minds from the beginning that information sharing was something that we were going to need to build into our program from the beginning, do it quite consciously, and recognize that it wasn't going to be easy. So to begin to look for the places where we would need to share information, who held the information, and what information we actually needed in order to deliver, let's say, for instance, a safe haven. The centre was, I would say, a trusted advisor from the beginning. And I remember colleagues from the centre joining us very early days and leading us through a workshop with some case studies about how people might come into contact with our services now and what would need to change in order to deliver the outcomes that we wanted. So some very early helpful developmental thinking when we were in that kind of discovery stage. Subsequently, the centre did a much more considered piece of work for us, really quite deep research piece of work that analysed where our information gaps were, so a really thorough kind of gap analysis, but also asset analysis, where we had information, where we didn't, where the flows were happening well, where there was clear leadership and maybe where there wasn't. So did a very good picture for us of the as is, and in that gave us some recommendations in terms of the to be, and we built those into our work program. So within 6 months we had built that into our work program, with the multi-agency steering board able to address some actions towards each of those. And I think that early help from the centre, both in terms of advice but also kind of analysis, a picture playing back to us, where we were, was incredibly helpful foundation for us. I guess since then, we've maintained that contact through the centre with help in terms of showing some of the challenges we're facing, advice, connections to other places that might have cracked it, or working like us hard to try and crack it, so you could share some of that learning. They also, in fact, just yesterday, we hosted a national workshop that the centre was leading with central government and other places, looking at information sharing challenges and opportunities around mental health. So again, I really I feel like I've watched the centre, get its feet on the ground and sort of spread its wings, and I'm really pleased that we've been able to be on that journey with you. About a year ago, the Transformation Challenge panel produced a report, and one of its findings was that we need more imitation and less innovation, and I thought that was very well put. But it is something that I think in local public services we're keenly aware that there is practice flourishing all around us, and that we have much that we can learn from colleagues in other places grappling with the same issues or slightly different issues, but how their approaches are developing around that. So I've been really pleased through the centre that we've been able to make some connections into other places that are also working their way through some information challenges. I was able to join colleagues from the centre at a visit to Melton in Leicestershire, and to look at some of the approaches that they're taking around, again, people with multiple and complex needs, in terms of helping them to transform their lives and get into work, get off drugs, get stable housing. those are absolutely the same sorts of outcomes that we're seeking to achieve in Surrey through our work around transforming crisis, people in mental health crisis, transforming justice, our work around emergency services collaboration. So in Melton, they're working with some very vulnerable people. In Surrey, likewise, we work with some very vulnerable people who share common problems and share common experiences of their interaction with public services, often inefficiently and ineffectively. And I took quite a lot away from the day in Melton in the way that they've taken a whole systems approach to improving people's lives. Information sharing is often seen as a technical issue. It's about the transfer of information between IT systems or sometimes paper records between people. It's fundamentally a question of leadership first, because it's the will and the commitment, first and foremost, to change those outcomes that I was talking about for vulnerable people, that sits underneath the commitment to move information around the system, the right information around the system, to use it wisely, to use it well, to use it collectively. So it has to start with the commitment from leaders to do that. There are two aspects for me in that. There's the local leadership, and I've seen that in Surrey, that commitment to share information, to do good, rather than to hold information, which often does harm. Local leadership, incredibly important, and that leadership that then filters right down through the organization, so it penetrates right down to the front line. And that can be difficult, but it's fundamental. I think also in that, we need central leadership, and I look to central government colleagues, central government departments, to ministers and officials to think about their role in providing the leadership nationally that will facilitate and enable local leaders to feel confident that what they're doing is the right thing. I have to say, being someone who works in a place, it sometimes feels like you have to be too much of a rebel to do this. It shouldn't feel like you're rebelling for the greater good. It should feel like centrally and locally we have a common understanding that information has to flow between agencies, between organizations, for change to happen and those better outcomes, and that we don't hold it because it's safe. It's not safe. It does harm. And so I look at it both ways. We need that partnership that will enable really much better practice, on the ground. I think one of the areas for tremendous development around information sharing is about using our information, again, collectively, to really understand the trends and the patterns that will help us to predict risk in people's lives, vulnerable people's lives, later on down the line. So some of the case studies of real people that I've been looking at most recently indicate that actually people's complexities escalate as they in a sense spiral through the system. Some of the case studies that I've seen recently around real people in Surrey, in Sussex, indicates just how significantly people's complex needs escalate out of control as their experiences of public services are not effective. And if we're able to use that data better and earlier to predict risk, then we ought to be able to intervene earlier and better, more cost effectively, in order both to prevent that escalation in risk in risk and in needs, and also to reshape our services so that they are less acute focused and much more preventative, and to do that in an evidence-based way. I'm really hopeful that as we start to use data better around people who are at the more crisis end of the system and understand their life journeys, that we'll be able to intervene earlier and better to prevent that crisis that will occur for them later on down the line. Public service reform is a core part of the Surrey and Sussex, the 3SC devolution offer to government. We're looking very seriously at how in the 3 southern counties, the 3SC, that we build in the potential for big system, whole system change over a much bigger geography, and the opportunities that allows us to transform at scale and at pace. Now, the early work that we've been doing around complex needs in both Surrey and Sussex is showing some really clear synergies in terms of multiple vulnerabilities, multiple needs. We're already sharing information and data around our different cohorts, how that manifests itself in our different communities, and it is different. And what we're doing about it in terms of our own commissioning. So information sharing is one of the 4 fundamental principles, actually, that we've got at the core of public service reform around people with multiple and complex needs in Surrey and Sussex. And we're starting to do that. So the data that we have, we're sharing with each other. We're looking at it through our own lenses, but actually asking questions about what does that tell you? What does that tell me? What could we do together on that? We're going wider than single agencies again. So we're looking at the data that's held across not just social care, but held in health, held in districts and boroughs, because we're a 2-tier area. So we think, again, coming back to this idea of being able to focus on complex needs and people at all ends of that spectrum, that by sharing information across geographies, we can test and challenge ourselves, try some interesting, innovative things in different places, learn from each other, and then where there's clear evidence to do so, we can scale out and scale up.